How long have you been considering this type of surgery?
Since the first time I zipped my neck up in my windbreaker, which was probably a good 5 years ago.
We are here today with Brad, the first morning after surgery. How are you?
I'm doing great.
So, Brad is my hero. Brad is 62, but he looked 40 something before I got a hold of him yesterday. And yesterday we did a deep neck lift, deep plane facelift, tiny, tiny, tiny touch of fat transfer. That's it.
That's it.
What kinds of research had you done, or had you had previous consultations? What was your journey before you got here to St. Louis?
I did have some previous consultations with more traditional facelift doctors and plastic surgeons, I should say, and nothing really vibed for me. And there's just so much information out there, and I was thinking about what would a good resource would be. And I immediately thought of a friend and I was like, she will know. And she knew, and she's like, well, there's a whole new type of facelift now, and it's a deep plane facelift. And there were a couple of people that she followed, and you were one of them. So I started following your site, and probably for a year and a half before I contacted you.
Okay. And then I remember your consultation was about a year ago because it
It
was
was a year
Halloween of
ago.
last year.
Yes,
And we're about 2 weeks to Halloween right now.
exactly.
What was that like in the interim? So I know there's a large period of time where we really didn't contact you much in the first part of that window. But then what was it like being like, my surgery's a year from now?
Well, I actually really enjoyed that time. It gave me a lot of time to get clarity on why I was doing it and to get very specific about what the procedure would do as well as what it would not do. And what I wanted from it and what I knew I was in trouble if I was expecting from it, because that's not the thing you get from this.
Mm-hmm.
So I wanted to be like kind of psychologically and emotionally in the right spot to get a result where it's like, I knew what I was getting. I got exactly that. Because you're already in that physical spot. I mean, you see all that. But just as far as you are as a human and in what time of your life and your development you are, that it was right.
Okay.
And it was. And the year gave me a chance to do that.
Well, good. It's a healthy outlook. So it can be sometimes, I generally ask people to keep watching the videos over that year because what we're doing changes little by little. And if they keep watching, they're up to speed. So
Yeah.
turn this way. I want to show them some details about our surgery. That's perfect. So what we did a true deep neck lift, which means going under the platysma muscle, which are like the abs of your neck, and sculpting the internal structures, the deep fat, the overgrown portions of salivary glands, overgrown portions of muscle, to create space. Right. Once we've created that space, we put the platysma back together like closing a jacket, trim the excess parts of the jacket since it's too big now, and that's what creates the initial shape under here. Then from the sides, we did the deep plane facelift, and this is called a preservation deep plane facelift. What that means is you can see the blue netting sutures. Wherever the netting sutures are, I'm only under the skin. From there, turn diagonally. From there forward all the way to his nasolabial fold was lifted. It was completely freed up, but all under the muscular layer. The area that is likely to bleed, and men are bleeders, is where we're immediately under the skin. So in all men and in women that are bleeding excessively during surgery, I use these Arswald hemostatic net sutures. So turn away again. So you can see from the pattern of sutures exactly where I was immediately under the skin. Just this little stripe here, just that little stripe there. Everything else, we were deep to the muscle layer and doing all the real work on the very deepest plane possible, which creates the real natural arcs and shapes. So it's not that that's the extent of the surgery. It's that all the surgery from there forward was done on a more anatomical layer and doesn't need to be netted. And interestingly, even though Brad's a male, was running high blood pressure yesterday, and males are oozy, he's got no bruises at all. And so that's really common, believe it or not, with the current techniques we use, especially this preservation lift. Thank you for letting them say, turn this way. How was your comfort overnight last night?
extraordinary. I know you probably won't believe me when I say this, but I have not had any pain. At the most, a one kind of right here, and you put the ice on it and it's gone.
So, did you see in your watching videos leading up to this, did you see other patients say no pain, and then some other patients say I had bad
Yes.
pain, slept, didn't sleep? Just see it looks.
I visualize being the first type patient.
Well, that's where
But
you
no
landed.
pain.
That's where you landed. Final question: did you sleep at all last night?
I did. It seemed a bit fitful, but in retrospect, I think I slept a lot more than I think I did.
That's the one that usually I get the failing marks on. It's uncommon that people sleep well. Most people don't sleep well at all. So you've had a
Yeah.
very lucky experience.
Yeah, because I don't in any way feel tired today.
Well, good. Don't expect this. This is he was superhuman when before we got a hold of him, and he's getting the superhuman recovery. Anything else you want to let these guys know about your first night?
Nursing staff, as you have heard many times, is fantastic. I'm on my third nurse now, and they take care of every detail. And while they all have the same level of expertise and care and are doing the same thing, each has her own lovely personality. So it's just kind of like being at a cocktail party in your hotel room and
you're
being
even
a
a
new
little
person every few hours.
You're even a little tipsy too.
Yeah, exactly.
Well, thank you. I greatly appreciate you being a male role model out here, and
Sure.
just another example of the different pieces of humanity that we treat, because everyone cares how they look as they get older. So, thank you.
My pleasure.
Brad is making all my other patients look bad with how I mean, we haven't even cleaned him up yet today, so you can see the little bits of dots, blood around his stitches. But other than that, look at these guys. Nobody looks like this the second day after a facelift, especially a man. Because men tend to bleed and bruise more. So I'm just anyway. 62 years old. He never looked 62 to begin with, and we did for him a deep plane facelift, a really nice deep neck lift, a tiny touch of fat transfer. That's it. So how was your second night?
The second night was good. Sleeping is a little fitful, I would say, but I did get a good bit of sleep. I feel great. I feel energized.
It's not sleeping well. That's actually pretty par for the course. And believe it or not, no significant pain is what the vast majority of my patients report. They report tightness, but no significant pain.
Yeah, and I feel like if I look in the camera and say that, people are going to say that can't be true, but it's true. I'm shocked that I haven't had any more pain. The level of pain is for those of you who wear glasses. If you have glasses and they get loose and you go to your eye doctor and say, can you just tighten these just a little bit? And they just very slightly over tighten, and you get that very little bit of pressure behind your ears. It's equivalent to that. It's nothing.
That's awesome. So, question for you. I can't tell you how many people commented when I put your little teaser video up. I said, okay, coming soon, Brad, 62. How many people commented, he doesn't need it? Doctor, don't you ever turn anyone away? Well, I mean, maybe he just needed some injections. Like, why would you do a facelift with someone like that? Basically, complimenting you on how amazing you look, and kind of being a little judgy, like, well, he looks so good. Why would he do something like that? How would you address those comments?
Well, I mean, in all honesty, I've always thought that I have aged well, and I would have been completely 100% fine not having the procedure done. And I actually wanted to be at that place in my mind. I didn't want it to be, super attached to having this and having the outcome. But I'll liken it to, so I went to an event recently and I pulled a suit out of my way back in the back of the closet from the 90s because all that stuff's coming back now. And I put it on. It's like, it looks great. But if I could just do this little tweak to the suit and this little tweak, my experience of being in this suit and wearing it would be so much more elevated than what it's like now. And I don't want to be glib, but that's really kind of the way I felt about this. Mm-hmm. My experience is great in my life as it is. I just feel like this is going to elevate it just a bit, and I'm excited about that.
And as far as we know, you only go around once, and you be happy.
Yeah.
Turn this way. Let me see what you look like. Again, we haven't cleaned them up yet today, so this is what you should expect. That we haven't really shown much of this. As the netting sutures weep a little bit, we see little scabs. We clean that up. We have nursing at home cleaning them up, but we clean them up every time we see them here. Same thing with the actual sutures that are closing the incision. So they serve two different purposes. The netting sutures are sealing the skin down to the surface, the undersurface, to prevent the accumulation of blood, which is more common in men. We leave these in 2 to 3 days, take them out, they leave no marks. It's crazy. It has also prevented him from having, again, any bruising, any fluid accumulation. They're fantastic. Turn the other way so I don't get accused of only showing your good side. Here's his other good side. Looks super stellar. I know these look crazy, but they are, honestly, in some cases, true lifesavers. When we have bleeding, we can't control any other way. The net will seal it down. So turn that direction. Anything else you want them to know about the second day?
It's really been a breeze. I know I keep saying that, but it's mind-boggling the amount of work that you did, and I just honestly can't even tell that anything has happened to me.
That makes me so happy. Well, thank you so much. And thank you for sharing with my folks. It really, it's so valuable to see every different experience. So I really share.
You know, the videos were essential for me wanting to go through the process. So I'm glad to contribute.
Thank you. We are 1 week post-op with Brad. How are you?
I'm doing great.
Brad is 62 years old. Exactly 1 week ago, we did his lower facelift in a deep plane style, deep plane preservation style, deep neck lift, little touch of fat transfer. That's it. You had your first manual lymphatic drainage, manual lymphatic therapy session today. What did they do? How did it feel?
It's worth getting the whole procedure done just to get that treatment. It is amazingly soothing and just a very gentle and loving touch to an area that's obviously undergone a lot in the last week, and you can just feel your tissues appreciating it. It's very light touch, both very slightly pressure point touch and also the movement of the lymph. And it just couldn't have been better.
Yeah. So we have our post-op specialist, Brittany. She does the manual lymphatic therapy and also the hyperbaric oxygen treatments. And the first couple of days we do this hyperbaric oxygen treatment, which I think helps perfuse the tissues. It's not dramatically better, but it's something we can do. And as we get towards the end of one's 10-day stay with us, so days 7 today, usually days 7, 8, 9, 10, we do a couple of those manual lymphatic therapy sessions, which is, again, helping to get the lymph moving. And it's just nice because you've been keyed up the whole week. Well, you haven't, but most people have been keyed up the whole week. And it's nice to have someone invest a little just human touch and attention. And it's both therapeutic and therapeutic, if you know what I'm saying. Turn and face me. Let's let them see what you look like. Again, Brad's making absolutely everyone look bad. I'm going to do some little close-ups of his stitches here for you guys. Right now, his skin is swollen. So because his skin is swollen, there's kind of a transition between the skin that is swollen and the ear skin that's not swollen. That will settle out 100%. Similarly, around some of the corners, there's little bits of swelling and transition. Totally normal. Little bruising on this side. We're going to get that with the laser to break that up in the next day or two. And turn you all the way around. Thank you, sir. Very similar things here. Almost no bruising on this side. A little bit of puffiness at the corners of the incision. Totally normal, expected to settle out. Somewhat less puffiness of the skin related to the ear on that side. So all these are completely within normal range. Turn back that way. I didn't mean to brush his butt real good there. Anything else?
Intentional.
Anything else you'd like for these guys to know?
I can't think of anything to say other than, obviously I did a lot of studying, and I'm very happy with where I am, and very much looking forward to where it's going to go. It's just amazing to me that this is 1 week out, and I feel and look this good.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.